Hi, good afternoon, everybody, and welcome to today's webinar, Fighting Hunger by Connecting State Partners and Centering Lived Expertise, made possible by the Robert Wood Johnson Foundation. My name is Alyssa Beers from the Center for Healthcare Strategies, and I'm honored to host today's webinar. On behalf of CHCS, our core partners and co-creators that you'll hear from today, we want to express our heartfelt gratitude to you all for choosing to spend the next 90 minutes with us. To kick us off, I'm so pleased to dive right in and turn the webinar directly over to Barbie Izquierdo, Consultant and National Spokesperson and Community Empowerment Manager at Hunger Free America, for opening remarks. Barbie, thank you so much. The floor is all yours.
Thank you so much, Alyssa. I've been asked many times, what does food insecurity feel like? What does it look like? And I would say things like food insecurity has many different meanings. To some, it means statistics like 38.3 million people lived in food insecure households in 2020. But to those 38.3 million households, it means struggle, shame, stigma, and being made to feel that they are undeserving. So today, I think I'll answer that question in a more personal way. You see, to me, to people like me who have been food insecure or are currently living through it, to us, it looks like countless mothers crying to their best friends about the injustices of the system. It looks like feeling like you want to give up, because through all of life's ups and downs, there's still always this feeling of injustice that will never seem to go away. There were so many moments questioning myself as a mother because I couldn't provide the basic needs for my kids. And no, that doesn't mean that we couldn't afford the luxury of eating a steak. It meant that there were many days where I fed my brain pictures because I couldn't fill my belly and the bellies of my two children at the same time. The whole time, yearning for some sort of economic justice so that we can enrich our lives. Feel validated, important, and ultimately, so that we can know we are enough and that we can handle anything thrown at us, despite how hopeless it may feel at times. So we're here today to help continue to raise awareness on what needs to happen so that people from communities like mine can thrive. Whether that means the streets of North Philly or rural low access communities in America, for us to actually have a chance to live freely. That means being equal and not having to choose between dignity and asking or receiving the help that you need. It means less tax breaks for the rich and less breaking the spirit and backs of low-income communities. It means flourishing small businesses owned by people who look like me. It means federal assistance doing the right thing before a recession or more people getting hurt. It means the elimination of barriers keeping my people from financial freedom, wealth, and stability, and centering people with lived experience in the fight to fix harmful policies. Economic justice, to me, grants us the opportunity to eradicate hunger and end the stigmas that separate humanity from government assistance. It means opportunity to help invigorate us by having things like access to financial literacy and economic opportunities for growth for everyone, without judgment, blame, or imposter syndrome. It looks like the deterioration of poverty and generational cycles of suffering forced onto us by people who have power that has been taken from us. It looks like livable wages instead of I challenge you to survive and I dare you to sacrifice. Economic justice is the sacrificing of systems to ensure the good of the people. In order to achieve the fairness that we seek, we must work together to break down the walls that keep us apart, the walls that promote silos and the oppression that happens to my average American, the ones that provided a life lesson and a plate of food to those kids whose parent couldn't afford it. Community leaders and advocates are born from these lessons. And when we share our experiences and expertise, we do so in hopes of bridging gaps, building relationships, centering lived experience and community engagement to uplift dignity while tackling the intersectionality of issues that millions of people face. We do this because our pain turns into our stories. Our stories may come from burdens, but our expertise transforms our burden into our responsibility to fight for a change. Thank you for being here with us and sharing your time with us today to be a part of that change. We invite you to be open and truly take in what we're sharing with you, and hopefully we will make you all feel safe enough to share with us in the chat as well. Welcome once again, and I will now pass it on to Alyssa.
Barbie, thank you. Thank you so incredibly much. Thank you for starting this event with your powerful words and your passion and your expertise for grounding us all in why this is so important and why we are all gathered here in this virtual space. I think if we were in person, you would feel the love and the inspiration in the room. I'm grateful, I'm humbled and honored to be here in partnership with you and with our collective team of presenters today, as well as all of the attendees joining across the country. I encourage everybody on the line to carry Barbie's powerful introductory remarks with you throughout the webinar and beyond, as I know I will. So Travis, if we can go to the next slide, please. So this slide shares a little bit about the Center for Healthcare Strategies. And I'd say at our core, we're a nonprofit organization that works with partners across Medicaid and related programs to ensure more effective and equitable care that leads to better outcomes for more people. And just in reflecting on Barbie's comments just now about bridging gaps and building relationships, in order to tackle the intersectionality of issues faced by so many, want to emphasize how grateful my team and I at CHCS are for the relationships and partnerships developed through the project that you'll hear about today, as co-design and co-creation with our community partners and our advisors for this project have been just critical to the success of the project and also to the formation of the policy recommendations that we'll discuss today. Next slide. So with that, I'm honored to introduce our partners and today's speakers over these next two slides. So Barbie Izquierdo, whom you just heard, is a consultant, advocate, and national spokesperson. Alice Aluwach is founder and executive director of Fariji Africa. And Yolanda Gordon is Manager of Expansion and Advocacy at Results. And Tamika L. Moore is Consultant with Lived Expertise. My colleague Nessa Fenice, Program Associate at CHCS, will also be presenting today. And just a huge shout out as well to our other CHCS team members that are also on the line, Kathy Moses, Diana Crumley, and Kathy Brock, as they've been all so instrumental in all facets of this project as well. Next slide, please. Following today's slide presentation, we'll move into a panel discussion that will be moderated by Jamaica Mills, who's co-founder of Equitable Spaces, and including fellow Equitable Spaces co-founder Diane Sullivan, who's just been an instrumental partner and advisor from day one on this project. We're also really pleased to be joined by Brianka Merritt, who is Chief Health Equity Officer at the Indiana Family and Social Services Administration, and Dan Hahn, who's Director of Self-Sufficiency Programs at the Oregon Department of Human Services. Next slide, please. So here is an agenda for today's session. Our goals are to first highlight opportunities to address food insecurity by connecting state partners and centering lived expertise, drawing from a recent national exploration undertaken. Also to present insights from community members with lived expertise, as well as state officials about opportunities to coordinate across programs like Medicaid and SNAP to address food insecurity. And also to explore ways to incorporate the experiences of community members into program and policy decision-making. Next slide, please. So I'm just going to really quickly provide a high-level overview of the project. Next slide. So this initiative, Fighting Hunger by Connecting Cross-Sector Partners and Centering Lived Expertise, essentially sought to better understand opportunities, barriers, and cross-sector strategies to improve the health of individuals who are enrolled in Medicaid and food supports programs specifically. Next slide. Definitions are important. So what do we mean by lived expertise? You'll hear that a lot during today's conversation. For this project, lived expertise is defined as the experiences of individuals who know the realities of hunger, poverty, and other societal issues by living them daily, who know how those experiences impact health and wellness, who understand the challenges of navigating public benefits programs for supports and services, and who know that their perspectives truly uniquely qualify them as informed stakeholders who can help to shape more equitable policies. Next slide. So through key project activities, including an environmental scan, key informant interviews with state officials across more than 10 states nationally, and a series of convening conversations with individuals with lived expertise, we explored these questions that you see on the screen. And we will drop a link into the chat to the summary report that offers recommendations for policymakers in 4 distinct categories coming from these information gathering activities. And as you'll note, while the recommendations and insights were drawn from conversations about addressing hunger, many of the learnings can be just broadly applicable to other important policy areas. Next slide, please. And so with that, I am just so pleased to turn the floor over to Alice Oluwach and Tamika Moore to begin the Community Insights presentation. So Alice, I'll now turn the floor over to you. Thank you.
Yeah, thanks, Alyssa. So there are a lot of challenges for individuals and families who are currently experiencing poverty and also trying to access public benefits. And I wanted to just spend a few minutes and highlight 2 or 3 examples that, in my opinion, I feel like they pose like great challenges when it comes to navigating this process. And so the first one is there's a lot of misalignment across different federal programs and agencies. A lot of these agencies use the federal poverty guidelines in order to set like eligibility thresholds for some of these programs. And so we're talking about SNAP, Medicaid, National School Program, etc. And a good example is like SNAP, right? SNAP is available up to 130% of poverty, but the coverage really varies from state to state. And then you have another example like CHIP, whose coverage goes up to 300% of the poverty level. And so if I am a low-income earner, I'm trying to access these programs, it actually means that depending on the family income, I might end up qualifying for one program and not the other. So I might get healthcare, but not be able to actually qualify to put food on for SNAP, which really I need to put food on the table. And then that trickles down to what's happening within the states, where we are continually seeing just a lack of coordination across state programs. These programs are definitely being overseen by different agencies, different eligibility workers, and also the funding sources are different. And so as a result, as an individual, if I'm trying to apply for these programs, I have to actually do multiple applications across different programs, keying the same data, right? Because among the states, like there's no sharing of information within the different programs, and basic information like name, age, sex, all those things are not being shared across different programs. And on top of that, it could also be in different locations. So where I'm filling up my application to get SNAP is a totally different location from where I'm applying for Medicaid. So just a lack of consideration in terms of things like access. How do I move from one location to another? And if I'm a blue collar worker, I have to probably be in person in my job, that means I'm going to end up losing the age one earnings, my wage earnings for a day. And so again, it obviously breeds inefficiency, not only to my side, but also to the agencies themselves. And so this trickles down to the last point that I wanted to share here, which is a lot of these programs, even though they're well-intended, we end up getting unintended consequences because there's lack of insights from people like me who have lived experience. And so the workers, the eligibility workers that are working in these offices really do not have like the user end experience of what we're experiencing trying to access these programs. And so in turn, even though the programs are intended to help families like us, right, who are experiencing poverty and need to put food on the table for our children, at the end of the day, we end up having experiencing trauma all over again. And when I think about immigrant communities, which is my community, and some of these communities really don't have English as their first language from the countries that they come from. So they fear or even just not understanding the process of going through the application forms. It creates a lot of chill effect. And we have a lot of families that honestly are eligible for these programs, to access these programs, not getting access to them. One, because they just don't understand the process. And two, even with the eligibility workers themselves, like there's no clear definition of rules and regulations in between what's happening on the immigration side and also on the federal side. And that ends up making a lot of us miss, not access the programs that we actually are eligible to access. And so I want to turn it over to Tamika to touch on the case management end of things.
Yes. Hi, everybody. How y'all doing? So the system tends to believe that once an individual is assigned a caseworker, that the issues this person is facing will be taken care of. When in reality, the outcome of their attempt to get assistance is determined by the effectiveness, compassion, and knowledge of that caseworker. A great caseworker can be a heaven sent to a person in need, but at the same time, an ineffective, careless caseworker can be a catalyst to this individual's demise. Take myself, for instance. I was actually homeless for 7 months. I went through 3 caseworkers during that period of time. 2 of them didn't assist me at all. The 3rd one informed me of why I wasn't being approved for benefits. And I took the steps to get approved and actually was approved within a week or so. That shouldn't be a part of anybody's story. No one should have to be homeless and sleeping in the street just because 2 caseworkers were either careless or didn't have the same knowledge as the other one. Okay, so I'm not really sure of all the causes for this discrepancy in the system or how to fix it. But I do know 2 of the issues affecting caseworker performance, one of which is fear of public charge. Fear of public charge is such a big thing. For a case manager to be afraid to actually give you benefits is disgusting. That's terrible. If they give you 2 little benefits, or give a person 2 little benefits, they get a slap on the wrist. But if they give them too much benefits, they could lose their job, they could get fined, even be put in jail, depending on the situation. That's not a way to run a system. They shouldn't be afraid to help people, so I think that's something that really needs to change. Another one is a caseworker burnout. A lot of times these individuals are taking on far more cases than they have the capacity to handle. So in conclusion, I think that we need more well-trained caseworkers, more compassion in this place, and as well as a revamp on the eligibility qualifications for a lot of public programs. And I will turn it over to Yolanda.
Thank you, Tamika. So working with any individual with lived experience, it is so important that listening to learn and not to respond is part of building a transformational relationship. Poverty is not a debate. It is not I know better than you. It is a position an individual is placed in, not because of personal failings, but because of circumstances. Feedback for programs is usually transactional. Without adding value from those with direct experience of safety net programs to aid in the initial steps of creation, unintended consequences are missed, especially at the policy level. Politicians go into politics to pass laws and not to implement them. They are elected, but never have to execute their ideas. When partnering with individuals with lived experience, building a relationship is vital to building trust and to make sure that that what you plan for policy change or implementation starts with the relationship and is not treated as just a transaction. Building a relationship can transform what was once the transactional experience into a transformational experience and validate the individuals you're collaborating with. It also assists in understanding the trauma of poverty. Outreach for said individuals will require a multi-pronged approach beyond the typical transactional survey. You must enlist individuals who can share their experiences from a scar and not from a wound. You can access groups and organizations to find strong advocates to assist with implementation or with policy design to make co-creation possible from a place of trust. Accessing community groups will help gain access to hard-to-reach populations. Building relationships in the community is essential to building trust. Engage in opportunities with individuals in safe and trusted spaces. Do not show up once looking for assistance. Build a relationship by showing up before you ask for assistance. Get to know the community. Do not focus on the individuals coming to you and meeting you where you are, because many of those individuals with lived experience cannot do that. Not every individual has access to the internet, so getting into the community is important. A one-off solution is not the most effective way to implement policy change, but the experienced stakeholders should have a seat at the table to provide feedback on or co-creation of policy changes. As a person with lived experience, I know that we must eat, sleep, and breathe policy so that we can advocate for our needs and for the needs of our communities, and to stay on top of proposed changes and to disseminate information in terms that some community members can understand. Having lived experience makes us policy experts. We know policy out of survival, not out of curiosity. When consulting with us, compensation is necessary because no expertise is free. Let me repeat that. When consulting with individuals with lived experience, no expertise is free. Compensate them as you would any other contractor because of the value that they add to the dialogue. Reimagining community engagement will require a culture shift. It will also require challenging and disrupting the white supremacist culture that our systems are built on. Supportive relationships and building trust, again, are necessary to ensure the operationalizing of community engagement does not strip the humanity out of the programs that many communities need to survive. Once trust is broken or unintended consequences are ignored, it is hard to regain that trust. Lastly, using the hiring process to engage with individuals with lived experience of safety net programs, because they can better assist in reforming programs, planning, evaluation, and implementation as a staff member as well as a consultant. This also helps break down the power dynamics that exist between client and case manager. And I will now pass it to Barbie.
Everyone. Investing in organizational culture change starts with promoting compassion and support over stereotypes and judgment. And because of those things, there's so many people that face systemic barriers when it comes to accessibility, affordability, and eligibility. I would like for all of you to think about that for a second. Being eligible to eat. These processes that people have to go through come with their own traumas. So let's make sure that we're both trauma informed and providing resources for mental health. Community members with lived expertise can identify opportunities to promote equitable, dignified, and trauma-informed treatment. So consider us in the blueprint of your work. Work with us in collaboration, because the people most impacted by policies and programs related to addressing hunger and health deserve their voices to be heard and their needs to be met with compassion, dignity, and respect. And how do we do that? We can start by following some of the examples released in the report, like convening state policymakers and program administrators, enrollment staff, and community members to discuss the current system and learn from individuals with lived expertise. Conducting trauma-informed policy and service delivery training programs for Medicaid and SNAP program administrators and frontline workers so that they can better assess and assist individual needs of applicants and enrollees. Lastly, but not least, I would say centering equity, dignity in policymaking and implementation. I know that we've mentioned dignity a lot in our webinar today, and I think that it's something that isn't truly addressed or brought to light. So I feel like it's my responsibility to make sure that people are being considered when they're sharing their experiences. With that being said, I'll pass it on to Vanessa.
Thank you for sharing your valuable insights, Alice, Tamika, Yolanda, and Barbie. As Alyssa mentioned earlier, we've also interviewed state officials to better understand where there are opportunities in cross-sector strategies to address food insecurity. Next slide, please. From those conversations, we've identified 3 categories of state Medicaid levers commonly used. I'll discuss them here, but just want to reiterate again that community engagement and voice can be relevant to all policy development opportunities presented here. So starting with benefit design. Medicaid state agencies can define benefits that seek to address nutrition-related needs or connect individuals to community resources, for example, targeted case management. States can provide home-delivered meals as a home and community-based service, commonly a part of the 1915C waiver, and obesity counseling and healthy diet counseling as other diagnostic, screening, preventative, and rehabilitative services in state plan amendments. States can also leverage 1115 demonstrations to pilot new nutrition-related benefits, including food boxes and SNAP enrollment support, such as in Massachusetts and North Carolina. Through delivery system, managed care plans can provide care coordination, quality improvement initiatives, and additional benefits that seek to identify and address food insecurity, also commonly referred to as in lieu of services and value-added services. States can encourage this work through tailored incentive arrangements, as well as explicit contract requirements. At the provider level, alternative payment models, value-based payment arrangements, and funding provided through 1115 demonstrations can help support whole person models of care and encourage providers to invest in services that address food insecurity and nutrition. At both the plan level and provider level, state Medicaid agencies can encourage and sometimes require partnerships with community-based organizations. For example, California allows plans to choose among 14 pre-approved, rigorously defined community supports, with medically tailored meals and medically supportive food as one optional in your service. The state will reward capacity building efforts with community support providers through managed care incentive arrangements, as well as additional capacity building funds through its CalAIM 1115 demonstration project. And lastly, program partnerships. Better coordination among state agencies and divisions that administer Medicaid, SNAP, and WIC could benefit beneficiaries through streamlined and simplified eligibility processes or complementary service delivery initiatives. For example, states can use Fast Track as an enrollment strategy, which is a federal policy option through which states can use information on file from mean tested public benefits, such as SNAP, to then determine eligibility for Medicaid. States can also use targeted enrollment outreach. For example, we've learned from Pennsylvania's Department of Human Services that they developed a list of more than 200,000 people not on Medicaid, but who were participating in SNAP or were parents of children on Medicaid. Using this individual level data and a dedicated outreach campaign through either mail or contact center, it was implemented through the benefit center to help clients in to enroll in Medicaid. The U.S. Department of Agriculture also launched a national school lunch program and school breakfast program demonstration opportunity in 2021 to evaluate direct certification with Medicaid. When evaluating potential Medicaid partnerships, state Medicaid agencies could consider complementing Medicaid-related funding streams with those from other programs. For example, the GovNIP for food prescription programs, the Emergency Food Assistance Program for food banks, All American Act nutrition programs such as Meals on Wheels, and SNAP aid for nutrition education. Next slide, please. So based on the valuable insights that you've heard from our community partners and learnings from our interviews with states, we have developed the following recommendations in 4 distinct categories. Next slide. So a key factor to successfully address food insecurity and other health-related social needs linked to poverty and racism is to partner with impacted community members in the development and the implementation of policy decisions and solutions. States can reimagine their community engagement efforts to really shift the power from systems to communities and allow for more shared decision-making. Including individuals with lived expertise in policy design from the start is essential for co-creating policies that meet both state objectives and the needs of the people that they are intended to serve. Doing so will interrupt practices that oppose systemic racism and perpetuate existing disparities in hunger and health. By investing in partnerships with community members and learning from the expertise, states can develop programs and policies that are impactful, equitable, and respectful. Support relationship and trust building with community partners to really drive engagement and cross-sector collaboration. States are very much interested in improving their community engagement practices, but may need support to strengthen their capacity to build trusting relationships with the individuals with lived expertise. And most importantly, meaningfully incorporate them in policy design and implementation. Community members engaged in this work also need support in cultivating mutually beneficial relationships, given existing power imbalances. This all leads to trust and transparency. State agencies can consider hosting community meetings and other community-led events to learn directly from community members. They can leverage technology for direct and consistent outreach through text messages and apps. And as you've heard, hire individuals with lived expertise to drive outreach and trust and help build trusting relationships within the communities. Compensate community members for their time and expertise, which we know it will require a shift in how states and organizations perceive work with individuals with lived expertise. States may also consider addressing barriers to engagement by amending policies that prohibit states from providing stipends and other payment arrangements, covering financial costs associated with engagement activities, such as transportation, exploring additional funding streams, and embedding those engagement efforts into budgets. Consider hiring Medicaid and social services agency staff with lived expertise. By hiring individuals with lived expertise as employees and consultants, this can really change the narrative in promoting more inclusive environments and meaningful dialogue that focuses on co-created solutions. This can also create more opportunities for economic mobility for community members. Next slide, please. To improve the public assistance programs, it is critically important to improve the culture in which these systems operate. States can center equity, humanity, and dignity in policymaking and implementation. And as Barbie mentioned, they can start by convening policymakers and program administrators, enrollment staff, and community members to discuss the system and learn from them what are the challenges, the pinpoints, the barriers. Secondly, incentivize increasing access to Medicaid and food assistance programs rather than preventing fraud, since the latter often contributes to trauma and stigma and disproportionately harms Black and Latino individuals and families. Third, develop and implement education and training programs for state, local, Medicaid, and SNAP staff on the history of inequities in policies in trauma-informed policy and service delivery. And lastly, embed equity impact assessments prior to approval for implementation. Equity impact assessments can help policymakers understand how groups that have been and continue to be disenfranchised and discriminated against will likely be affected by proposed action or decision, and really understand the unique perspectives and needs of various populations. Next, please. To improve the enrollment and eligibility processes, states can also do the following. First, invest in data and technology systems that will support data sharing across programs and agencies. They can explore different avenues to accomplish this. You can try establishing data sharing agreements between partnering agencies, updating systems to support multi-channel document submission to reduce duplicative efforts, or create a common application to streamline enrollment across state programs. Second, engage in redesign at the federal level. As you've heard also, many programs are overseen by different agencies with varying requirements, which largely impacts alignment at the federal level. For more impact and synergy, states can reassess the eligibility requirements across federal programs to close the gaps between eligibility and enrollment. They can also work closely with the federal government to develop more consistent standards across the states to ensure more equitable access. It's also important for states to consider the realities of employment and determining eligibility. Depending on the type of employment, someone's income can vary drastically from month to month, which can impact them accessing the resources and the services that they need. Consider providing self-employment deductions to self-employed or gig workers, which could help these constrain and improve access. Involve individuals with lived expertise to refine outreach and enrollment processes. States can collaborate with the community and individuals with lived expertise to ensure that the outreach and enrollment strategies meet the community's needs and are person-centered to optimize how the system works for individuals. Explore innovative multi-sector partnerships. At the state level, identify opportunities to involve sister agencies or departments, those that administer SNAP, WIC, Older Americans Act nutrition programs, and Medicaid policy development relating to food insecurity. This may be accomplished through streamline and simplify eligibility processes or complementary service delivery initiatives. Next, please. And here for our final recommendation for how states can use Medicaid levers to screen for food insecurity and provide needed services. First, strengthen community resource. Across the country, state Medicaid agencies and healthcare organizations are working hard to expand screening for social risk factors, but often worry that individuals would not be able to access services that address those identified needs. While the scarce resources can complicate navigation and referral, screening results can help identify those needs and help inform clinical decision-making, and most importantly, help Medicaid members access SNAP. States can also consider, for example, to use Medicaid funding to expand access to nutrition-related services and build the infrastructure needed to support longstanding and sustainable partnerships between healthcare organizations and social service organizations. State Medicaid agencies can also elevate those critical needs to state and federal legislators to support funding. Identify measures that resonate with communities and individuals with lived expertise. Community-defined measures can help keep governments accountable to the people they serve. Regional organizations like the Accountable Health Communities and Health Equity Collaboratives can help facilitate those conversations with community members and ensure that process is collaborative, transparent, and responsive to community needs and priorities. Additionally, states can look into innovative, patient-centered measurement initiatives that are supporting healthcare stakeholders in moving towards a more equitable and patient-driven measurement ecosystem. And last, expand access to healthy, culturally prepared meals and food. Medicaid can help individuals access nutrition supports that are not otherwise available through SNAP. For example, individuals experiencing homelessness, individuals who need assistance with activities of daily living, or people recovering from inpatient stay may have difficulties preparing meals using groceries purchased by SNAP. And as of now, SNAP benefits cannot be used to purchase prepared meals. And as the payer of last resort, Medicaid can pay for health-related nutrition supports that are not available elsewhere. With that, I'll now pass it over to Alyssa to introduce our panel. Thank you.
Thank you so much, Nessa, for sharing not only the insights that were gleaned through the one-on-one interviews with states during this project, but also for taking the time to walk through the recommendations and considerations for policymakers that were informed by the collective. That was really fantastic. And we're just reiterating our thanks again to Barbie, Yolanda, Alice, Tamika, and Nessa for just sharing those moving and powerful insights as well as learnings. So I'm going to ask that we transition from the slides and transition us into the panel discussion so that we can carry those insights on and have a very real and honest dialogue about the challenges faced and some of the key considerations that have come up across a diverse key stakeholder. So I'm going to ask our panelists to all start their video at this time, and I will pass the microphone next into Jamika Mills' expert hands as our moderator. So Jamika, it is all yours.
Thank you so much, Alyssa. Great afternoon, everyone. And if we were meeting in person, I would pause here to give Alice, Barbie, Tamika, and Yolanda a round of applause for their commitment to this work and for sharing with us today. So I encourage you all at home or at the office in the audience to send some affirming comments and any questions that you have in the Q&A. I am Jamika Mills. I'm the co-founder of Equitable Spaces, where our mission is to create opportunities for community members with lived and living experiences of poverty and related issues to incorporate their knowledge, perspectives, and expertise into policies and programs that directly impact their lives. Equitable Spaces provides customized training and technical assistance to state, local, and national groups that seek to engage this expertise in research, in policy design, and implementation. So we're grateful to CHCS, the Robert Wood Johnson Foundation, and our panel of state partners for trusting us to drive the design and agenda for today's webinar, this particular section of the panel. And so we're honored and excited to share this space today and what we hope you all will experience as a refreshingly honest and, yes, even challenging at times discussion around advancing equity through systems co-designed with community. And by community, we don't mean community-based organizations, churches, or individual advocates. We're specifically referring to community members with the lived and living experiences of hunger and other poverty-related mental and physical barriers to health. Those of us often overlooked as key, relevant, and informed stakeholders in policy debates and decision-making. Historically, those of us who have been negatively impacted by the systems we depend on to thrive in this country have not been invited into these conversations. That's why this discussion is so important to me, because by putting community in the driver's seat, it challenges the notion that we can only show up as data on a PowerPoint or as story bank trauma from a comms team. It forces us to get beyond the titles of client and customer, instead seeing us as whole human beings. This discussion is important to me because even the fact that we're engaging in conversations in new ways is a demonstration of the culture shift we all so desperately need. Although the focus of this webinar and report is on collaborations across sectors to address hunger, the learnings, as Alyssa mentioned, must be applied broadly. So I want to kick off our panel by inviting my esteemed panel mates to each introduce themselves and share why this discussion is important to you. I'd like to start with Diane.
Hi, everyone. Thank you so much, Jamika, and good afternoon. And I too want to thank all of the speakers that came before us before this panel discussion. I am Diane Sullivan, co-founder of Equitable Spaces, of which Jamika spoke. I am a mother and grandmother with the lived experiences of hunger and homelessness and other poverty-related health determinants or detriments, as we all know they are indeed harmful, as seen through whichever lens we apply. The unique lens through which I view public policy and its impact is one built on the foundation of these lived experiences, sharpened by my years in direct service doing eviction prevention work, and refined by a decade of service as a policy director of a small nonprofit here in my home state of Massachusetts. And no matter where I am or who's in the room, I aim to always speak truth to power by applying this knowledge and perspective that I've gained through these experiences. And as Jamika said, it's not often that those of us with lived or living experience of poverty have the opportunity to join with state agencies in really meaningful ways to engage on and share ideas for policy solutions. Historically, again, as Jamika alluded to, our relationship really hasn't been conducive to that. So let's keep it real. Regardless of your lens or experience or how you feel about what I'm about to say, we, those of us with these lived and living experiences, view the system as the oppressor. And for those who can't see me, I did air quotes around the system. We have the stories and the scars and the trauma that we can directly relate to policy to prove it. And so who is the system? In a general sense, our understanding, and I'm sure that, others much smarter than I have explained this better than I will, but essentially the system is the federal government, of which state governments are an arm, through which service providers are the fingers. So I think, and well, what I hope that we accomplish here today and why this discussion is so important is that what we'll demonstrate is that these conversations where we can bring together those of us for whom trauma of oppression is real and ongoing, we can bring us together with state leaders and understand that these conversations are timely and informative, and they are really worthy of our investment of time and energy and our public resources. And I think really, it's the start of the culture shift that you referenced, Jamika.
Thank you so much, Diane. I want to toss it to Brianka.
All right, hello everyone. Again, it's an honor to be here on this panel and a part of this very important discussion. My name is Brianka Merritt. I'm the Chief Health Equity and ADA Officer for Indiana Family and Social Services Administration. This agency oversees all social services for the state, including Medicaid, SNAP, early learning, disability, et cetera. And in my job, I oversee the Office of Healthy Opportunities, which is charged with identifying social risk factors and health inequities and identifying ways to address them. So I am here for a few reasons. One, I am not somebody with lived experience in poverty and hunger, but I'm a generation removed from it and the daughter of somebody who's worked in social services. And so I've spent most of my life being the person tagging along and, like everyone has said, seeing other people's trauma and being in a position to try to do something about it. So I've spent my career trying to figure out how to make that link between community need, policy change, and feedback loops and meaningful support for people with lived experience. So this discussion is important to me as a state leader because we're actually in the position to do something. When we talk about systemic inequity, it's us. It's not the people, it's not the experiences, it is us continuing to perpetuate and create those burdens and difficulties for people. And we know it's a process to address and resolve, but if we don't have at least the conversations like we're having now, it prevents us from moving forward. So I appreciate this discussion as a first step to hopefully some more systemic change. Thanks, Jamika.
Thank you, Brianka. And Dan, can you wrap us up on the intros?
Absolutely. Thank you, Jamika. And I just want to thank the whole group before me. An absolutely amazing group of people talking about something that is very, very, very important. And obviously all the participants here know that. I am Dan Hahn. I am the Director of the Self-Sufficiency Programs at the Oregon Department of Human Services. In Oregon, I oversee the SNAP program, the TANF program, the Employment-Related Daycare program, as well as doing eligibility for all of our Medicaid programs. Now rolled out last February. So why is this so important to me? I'm a white man of privilege. I grew up in a very middle class world where we didn't need to access state benefits in order to get by. I am college educated, I have a master's degree, and I've never really experienced or lived poverty. I do this work because I care about people, because I want to make the world a better place, as Brianka said. But that process requires me and my culture and who I am as an individual to recognize that this role I took on to do good has not always done good, has not always done the right thing, has not always been right. That I have been I step into a position in government, as Diane just talked about, and government is the problem. And in order to fix it, it is not going to be through the lens that I bring to the table. It is going to be through the lens that people like the people talking today bring to the table. And then it's going to be my position of authority and power that's going to allow me to make those changes and to acknowledge that my privilege gives me the opportunity to change the system. And if I do what Vanessa talked about, and Vanessa just laid out the plan for us, by the way, I can do that. And so I'm here because I want to do that. I want to be that change. And I think that everyone here who's in a position in government, if we can check our government cultures at the door, if we can check our egos at the door, and if we can listen, we can make the change that's probably the reason we came into this stuff in the first place. Back to you, Jamika, and I will anxiously await some questions.
Thank you so much, Diane, Brianka, and Dan, for your thoughtful responses. And, you know, Dan, your response, you know, it really has me thinking about, you know, we're all on the theme that we need that culture shift, right? We all agree that we desperately need it. And, you know, it really, for me, it starts with folks who have all the right intentions, right? All the things that Dan just spoke to, right? The power, the privilege, their goal is to ensure that individuals and families are getting the access to the food and housing and healthcare they need within a system that is designed to help them holistically, right? And that's a great thing. But Diane, I think I'll ask you, I would love to hear what happens when, in spite of our best of intentions, right, our impact is not reflective of that? Or maybe a better question is, can you share what that looks like or how it may show up in policy design and program design?
Yeah, absolutely. I'm just so grateful for this, you know, conversation, and Dan for even the acknowledgement that our best of intentions, sometimes the impact is just not good. In fact, we've seen that historically, but this is such an important question, Jamika, and it's probably safe to say, as Dan alluded to, that every single person hearing my voice right now has the best intention in heart and mind when they wake up in the morning, to play their role in addressing hunger, ensuring equity across systems, housing those who are experiencing homeless, making sure that everyone has access to healthcare. Yet many of us remain entirely disconnected from our impact. And this takes on, many forms, as you said, Jamika. I've often said that one of my skills is to foretell the unintended and often harmful impacts of seemingly well-intended policies. And too often I've witnessed administrations and even entire legislatures work tirelessly to solve for problems that never existed in the first place. This is the reason why here in my state in Massachusetts, we have photos on our EBT cards. And this was, the intent was to get at fraud, waste, and abuse. But I know we've got a room full of state administrators here who understand photos on EBT cards don't get that because they are PIN protected, because retailers cannot legally treat us as EBT card holders any differently than they would any other retailer. So, it was the intent, to get at fraud, waste, and abuse. And the impact is, in fact, shaming, back to what Barbie was talking about, with somebody in need of services. Now my photo is on my card and everybody knows, I'm on the system, right? And it shows up in policy, in design, implementation, and even how we evaluate the work. And, I'm thinking, on a real tangible level though, and I think how it often shows up is through language. And, I think about what we just heard from Dan, right? In his title of Director of Self-Sufficiency. And, while Dan, I don't doubt your credentials and the impact, that you've had in your career, but what is exactly a Director of Self-Sufficiency? And I may not be able to explain, the intent or of the role or the title as Dan can, but I can tell you the impact that has on me. And perhaps other community members would agree with me. Because, if you do a quick Google search, I took a little note here, that to be self-sufficient, one must need no outside help in satisfying one's basic needs, especially with regard to the production of food. Needing no support to meet one's basic needs. And I would argue, or I would ask us and challenge us to think, are any of us self-sufficient? Did you build the house in which you live? Do you drink water from a spring and wash your clothes in a stream nearby? Did you grow and harvest your breakfast this morning? And Dan, I don't know, I'm sure your resume again is impressive, but anywhere on there, does it say that you're a farmer? So, this may be an overly simplified example of impact versus intent of language, but when I hear the term, the Director of Self-Sufficiency, and that I'm supposed to become self-sufficient, my reaction is like, what gives you the right to direct me to accomplish something that you yourself are not capable of achieving? And of course, Dan, by you, I don't mean you, but it's this really glaring disconnect between language. And I would think that it's largely in part because we haven't been engaged in these conversations. And by we, I mean, of course, us, those with lived expertise, we haven't been engaged in these conversations in a meaningful way, I think, until now.
I'll jump in.
Yeah, absolutely. Absolutely. Please, Dan.
Yeah. So Diane, I appreciate that because one, as the Director of Self-Sufficiency, I get to tell you whether you're self-sufficient or not. And that's the godly anointed role that I found myself in. I obviously say that in jest because I totally think that you're right. I think that at a point in time, somewhere before me, the idea of self-sufficiency was a good idea, according to government, to name a program after it, a program that in theory helped people achieve not requiring government benefits. And I agree with you. I actually think, and I've hated the name since the beginning of this, and of course it's government, so it takes a while to change a name. But I agree with you. I am not a self-sufficient person. And it's not just about food in my house. I could not have made it through this COVID crisis without my community, without my people, without my wife, without my kids, without my neighbors. We all live in a community. And I think that's something that we as government need to realize too, as you look at some of our SNAP policies. You can't have people living in your house preparing food with you because that's a separate case, and those kinds of rules that get in the way of the reality of the way people live. I agree with you, words matter. One of the struggles we have regularly in government is that words actually do matter. They do carry weight, and we do a horrible job of using our words. I'll give you an example of that. We used to refer to our staff as field staff, our staff in the field. That is truly offensive to someone of an African-American background, of Latino Hispanic background, who literally had to work in the fields in order to earn an income. And here I'm just naming my service delivery arm of my organization, and I call people field workers. And so there's a word that matters. I think another word that matters, and Yolanda talked about this earlier, is in a way, the idea of participation. And yet I have case managers. I manage people. You who require our services to be able to, as comfortably as possible, navigate the world, have case managers. They manage you. They tell you what to do. And we in Oregon moved towards the idea of family coaches a while ago. And it's totally all about what Yolanda talked about. As a family coach, I can pull up alongside the family, not the case, the family, and get that active participation and work with someone as a peer, with me having access to services that someone else may need, and me being able to coach and provide guidance, but guidance in the things that you've identified you want to work on as a member, as someone receiving services. And I'm struggling here right now, right? Because what do I call people? Are they customers? Are they clients? Are they participants? Are they consumers? There's another word we struggle with. What do we call, in this case, we've gone to the Oregonians who need our services, or the Oregonians we are working with, because we struggle with words, and words matter. And I think as we look at our role in government, we need to acknowledge that. Much like Diane, Diane just called me out for it, right? I mean, I'm the Director of Self-Sufficiency. I get to tell you and direct who's self-sufficient in my state. That's ridiculous. Words matter, and we got to get better at that. And thanks for calling me out on that. I appreciate it. Now I'm going to go cry. I'm just kidding. Back to you.
No, and I want to, we told people at the top of this that this is going to be a real conversation. We're going to be vulnerable and transparent. And so I thank you so much for that. And, thank you, Diane, for even, raising the point of language and the importance of language. And really, for me, it drove home like how polarizing language can be and the power that it has to uplift or oppress. And so, yes, Dan, language is very important. And I want to talk to Brianka and bring you in on this conversation too, specifically on the topic of language, because we know about some transformational work that's being done in your office to address language. Specifically the language used in assistance denial letters for SNAP. And I want to know if you could share a little bit about the project and the particular experts that you guys chose to lean into when crafting your new correspondence.
Yes, thank you. I want to honor some of the words that folks said earlier in this conversation about the trauma, the disregard, and the feelings that it's like when you feel abandoned by the system. And I think that's part of what this project was intended to do, to give people some dignity and to also equip the conversation a lot better about what to do in the case that your benefits are cut off. And it's terrible to be in a position where your agency is associated with somebody else's trauma. And that's essentially what happens, right? They see our name and they know it's probably not going to be great news. And so the premise behind the work was, as an agency, how do we do a better job at communicating very problematic experiences to people who are at their most vulnerable? And so what they did as part of a way to kind of rethink some of this work is bringing together people with lived experience in addition to hunger advocates. And that's important, I think, too, because as someone mentioned earlier, usually people with lived experience are kind of separated out or treated differently or not brought to the table at all. But not only were folks brought to the table, it's an opportunity for us to be humble and receive that information for a system that frankly hadn't been looked at in a meaningful way from a place of trauma and negative experiences associated with getting those notices. And so a lot of the work that happened focused on reviewing those denial notices section by section. And a lot of the information that we got was things that you would think are pretty common sense, but actually in the context of going through the different steps to create these types of notices wasn't really present. So things like, we don't understand the deadlines to appeal if I disagree with this. That's a pretty important thing to not be able to understand. And so not only was that an issue, but the fact that people didn't feel empowered to also then follow up. Again, we don't want people to be in a situation where they're in a denial situation, but if you don't even understand the process to do something else, and again, we wish those processes weren't there, and the fact that they contribute to additional trauma, that is a huge problem if that's the whole point of those notices and no one understands what to do next. So having folks at the table who have lived this, who are currently going through the system, give us real-time insight about what happens and what we can do better is really important. So now we're at the point where we are trying to compile that. One key thing is making sure that things are written at a 5th grade level. We know we're working with folks with different levels of literacy, and the fact that that type of information is disseminated in a way that is not clear to people with degrees is a problem for a lot of folks. So we're in the process now of trying to incorporate that feedback into those new notices, sending it back out, engaging our community members again. I would say one thing that we can do better, of course, is figuring out, I think, one of the key findings from this report is about incentivizing people and paying them for their labor. This is labor. This is not just people in their free time. Like, we know they care, but that's not sufficient. And we've definitely run to the barriers time and time again about how do we sufficiently pay folks for their work, particularly in this space, because we do it for people with lived experience with substance use. We don't do it in this hunger space, at least at the state. So we're trying to also think of better ways to engage people continuously in a relationship for this process and not simply kind of a one-time research project angle to this. So again, it's still in work and we have some learnings and things that we need to improve on as well. But I think it's a positive step for a state that probably hasn't historically put that mirror up to itself to be a little more inclusive in the process.
Thank you so much for sharing that, Bianca. And just, yeah, for me, highlighting, you know, the need to engage community when we are thinking about the parts of our structures that are not working, because those are the folks that are going to tell you how to get it right. And Dan, I know in Oregon, you guys knew it, right? And that's why you guys started the work to build an advisory board. I want you to share a little bit about that, but you know, in your very honest and transparent way, please share with us like some of the challenges, specifically like engaging directly with community members and, you know, some of the restrictions that are put on you guys, you know, maybe federal government restrictions, but, you know, just if you could share with us, you know, some of those challenges to engaging directly with community members and yeah, some ways in which states can help to improve that process.
Thanks, Jamika. Yeah, I know we've talked before about this. It's, you know, in Oregon, we have something on the books called the Family Services Commission, Family Services Review Commission. And the idea is that this commission, made up of both community organizations and people with lived experience, would give self-sufficiency. I may say that now, Diane, I'm going to cringe. Give my programs insight into what we were doing, how we were doing it, and the impact we were having. And over time, it just became community-based organizations as members, and people who were, because of the work they do, we were accepting their words as the proxy, if you will, for people with lived experience. They weren't the people with lived experience. And obviously, what that did was that got us farther and farther away from the community voice we needed to hear. So we went about trying to kind of breathe new life into the FSC. And what we found was a ton of obstacles. Because it's on the books, we can only reimburse people a per diem to meet with us. Pre-COVID, no one really used these kinds of platforms, right? So we wanted people to come to Salem, to the capital of Oregon. And what do you do with your kids if you live in poverty during the day? How do you get there? The per diem doesn't begin to cover it. And so what we had was a barrier self-imposed by government that we can only pay the per diem reimbursement for people to participate in this. And that just wasn't going to happen. And so unfortunately, you know, that's one of, I think, many issues we ran into. The other one was when we did kind of abandon this and said, no, you know what we're going to do? We're going to go to the communities and we're going to listen to people, is we did the typical government thing. We showed up, we listened, we heard you. We patted ourselves on the back for doing an amazing thing, and we left, and we didn't circle back. We didn't check in with people. We didn't really talk to people. I think one of the other things we did, and I saw it in the chat, is we didn't actually teach people or show people or help them understand where their voice could matter and help us. We just went out and listened. And until people get that kind of professional development, if you will, as I see the language being important there, again, of teaching people, what does it mean to be on a commission? What does it mean to give feedback that's meaningful? How can you maximize that? And it's not me teaching it. It's a community partner that we ended up engaging with teaching it, because they're the advocates. I'm not an advocate. I'm a government worker who does advocacy on the side. But I mean, I am a government worker. I am the state of Oregon. So we needed someone else to really say, how do you develop your message so that the government won't hear it? And so, you know, we had to work through some of those things. But it's been a real big challenge to make it, to really navigate within the system of, where do I even get money to pay people for their time? All my programs have limitations on their money and what I can and can't do. And that's a limitation that I run into over and over again. So we continue to work on it. There may be other people who've been more successful than us, but we definitely ran into a lot of challenges there.
Thank you so much for sharing, Dan. And I know Diane specifically, I know you are very knowledgeable on the subject of building an advisory board. Can you share some insights for folks thinking about trying to do this? What would you say are the core elements of engaging community members directly and really making sure to center dignity.
Yeah, thanks, Jamika. I think to start, we have to acknowledge that this component of equity work, the work of directly engaging people, community members with lived and living experiences in policy and program design, it really has to rise to the level of priority. We all know that our budgets are a statement of our priorities. We have to make these investments. And I think, a lot of folks are just learning that, wow, about the time and the energy and the resources needed to be dedicated to do this work right. And I'd have to circle, back to the point of building relationships and getting comfortable with the uncomfortable. I'd argue that if, as a state administrator, if you're working, really toward equity through policy, right, and it's not challenging you or even perhaps like emotionally draining you, you may not be pushing yourself beyond the performative. And we really need to, to push ourselves there into the space of really getting the work done. This work requires, and what I hope we're displaying today is a new level of transparency and vulnerability that government officials typically aren't encouraged to put on display. Most of us, I hope, are aware of the recent, last December, the executive order issued by President Biden that calls for a reduction in barriers for those experiencing poverty in the enrollment and recertification processes and access to federal programs. And, the idea, of course, is to deliver more equitable and effective services by engaging people, this is stated, in the design and improvement of federal government programs, processes, and services. And, Jamika, we, at Equitable Spaces, we wholly agree with the president's assertion, of course, that the customer experience and service delivery should be, quote, driven fundamentally by the voice of the customer through human-centered design. And I think we'd go further and argue that indeed equity demands that they must. So, we have to really think about, what does this mean for those with the lived experiences of poverty and hunger and inequities? What does it mean for state and county and local agencies who administer public benefits? And, what does this mean for our nonprofit partners? I know that this conversation is about, in part directing or connecting states directly with the communities that they serve in different ways. But absolutely, it doesn't negate the importance and the need to have our nonprofit partners at the table and as a contributor. And I think it's all for us as individuals to really think about, what does that mean for me? What does it mean for you? And I would say that if we're going to successfully carry out this, a rather lofty order, and to engage community members with the lived and living experience, it's necessary for states to do a lot. There's a lot that needs to be done and that we can improve upon. But we've got to invest the time, energy, and resources that are necessary to engage community in co-creating this culture shift. We have to be, as we've talked about, intentional about language, addressing power imbalances. And, one way that we can do that is by inviting community into the space to help shape the agenda, right? So that we're actually part of setting the table, not so that we're creating one seat at the table for one person with lived experience to represent entire communities, but so that we're actually sharing the power balance, so that maybe half the table, half the room is filled with people with lived experience. We have to go beyond focus groups and story banking by inviting community members into our processes and ensuring that they have the supports to show up and really fully participate. Continuously seeking feedback, we've talked about that. And you've got to be open to criticism. This work, there's really no room for fragility in this work. And understanding that these partnerships are actually mutually beneficial. I think for us on our end, it helps to, with professional development, with getting to, what Barbie talked about earlier, economic justice. But it also is beneficial to states, as, Dan pointed out, you're going to need us at the table. If we're going to do things differently and do them equitably, we have to be part of the conversations.
Whew. Yes. just affirmations and feeling it all. I want to, because also we started this conversation off, talking about the work that was going on in Oregon to get an advisory board together. But Brianka, we know from your interview that we researched for this project, there was mention of building a community engagement team that will become an advisory board in Indiana. So considering the presidential order, like Diane just mentioned, in your role as cross-sectoral chief equity officer in Indiana, what do you see as opportunities for your state and for others in terms of advancing equitable policy and partnerships with communities that you and others serve?
Yeah, thank you. I mean, I think it's exciting and short. There's a lot of promises and a lot of barriers at the same time. I think the biggest thing is that we haven't had a nice runway to be justified in doing this work. And so, like you said, there's always kind of been this government community barrier. And what that does is gives us a justification to say, hey, we need money for this. Can you support us in doing this work? And it centers people in a way that we have not done historically on paper. And it, again, gives us justification to meaningfully involve community, not just, again, at the table, but like really leading policy change. And that's something that we've not been able to do before. I actually recently was able to get some federal dollars to help support community positions in my office because I can use language that references that order and other things that we have not had before. And so the justification is there in a new way. I would say the biggest barrier with it, though, is that we don't have stronger legal language. So if President Biden is out of office, that executive order kind of goes away too, and it doesn't really have teeth, but it's something there. And so until states, for those of you who are working at the state level, can advocate and create spaces for that yourselves, there's always the chance that that goes away, and some of those opportunity and connections do as well. In terms of how that's helping us here in Indiana, not only are we building out a community engagement team of folks in our agency who work directly with people in need of services, we're also working on building out an advisory board that is more of a doing board. So it actually combines the needs of folks in the community with the people who are in charge of addressing those particular social drivers of health. So for example, we know folks have a ton of issues with transportation access. Why not bring together our state transportation agency, our local transportation folks, some of our other vendors who provide transportation, and people who are having the transportation issues, folks with disabilities, et cetera, and having real conversations about what we do next, so that it's not just staying with our office, but there's responsibility for the other entities that have to do this work on behalf of folks we serve across the state. So we're in the process of building that out in the hopes that we can actually, again, do some visioning and some thinking, but ultimately be a space where folks can not just tell us what's going on, but we can actually do something about it and share with them what we're doing as a result of their input and their participation in co-design in the work.
Thank you so much, Brianka. That was and even the idea of like, now this gives us the opportunity to leverage more resources to focus on, it's refreshing for a community member who has had to give their time and not be compensated, and just, kind of hope and wait for that change to happen. So I'm grateful. This conversation, you guys, could go on for another hour. But I want to make sure that I'm able to close us out with allowing you all to share some key learnings and practical suggestions from each of your respective lenses. And so I'll start with you, Dan.
Thanks, Jamika. This conversation could go on for hours. I think this is an amazing group of people, not including myself. I would rather just shut up and listen to everyone talk, quite frankly. I think it's an amazing group. For me, the biggest takeaway today was that Alice, Tamika, Yolanda, and Barbie really laid out the why this is important. Vanessa really laid out for us how we fix this. She just gave us the strategic plan as state entities on how to fix and how to do this the right way. And I think it is the right way, and it is something that we're going to look at in my agency and really look at how we do this stuff better. I will say one of the biggest takeaways that I got from the preview of Vanessa and what she talked about was what she calls the equity impact assessment. And I'm just going to encourage you all, anytime you change a policy, anytime you think about a process, anytime you think about the work you do, find an equity impact tool, look at it, ask yourselves the questions, how is this impacting the people we serve, and actually go out and ask them, listen to them before you do anything. And that will get you moving in the right direction. And then all of those things that Vanessa laid out for us to do that may take a little more time, will get you the rest of the way there. It really, like I said, Vanessa laid out the strategic plan after the group earlier laid out the why. So it's all here for us. I'm going to use it. I'm going to encourage other agencies to use it within Department of Human Services, within other areas that I have contact with. It really is an amazing thing that Vanessa gave to us today in that explanation of what we need to do differently.
Thanks so much, Dan. Brianka?
Yes, I would definitely echo what Dan said about the key steps. I think one of the biggest things, I think as Dan or maybe someone else mentioned earlier, maybe Jamika, that if you're here, that you already care. And I think what we find a lot in this work is that people care and then don't know what the next steps look like. So I do want to reinforce kind of the tangible things that that were highlighted earlier today in that report. I just wanted to add as well, just continuing to practice as much humility as possible. And I think for me, when you're in some of these positions, so I think someone asked the question about what do you do if you're not in leadership? I think we all have an obligation to engage with people who are different from us as often as we can, and not in a way that supports kind of, trauma porn or, opportunities to capitalize off of people's experiences in a negative way, but as a way to really energize you to do this work with purpose and to really use that feedback again to tangibly make connections about what you can do in your work. So it's not sufficient just to kind of, read some things and hear some things, but really go out and talk with people that you're serving about, where are your gaps? So even if you're not in a place where you can change policy and address implementation issues, just keeping those ears and eyes open in a way that keeps you a continual learner and having patience for the process. Because if you're just here today kind of learning about what to do next, it's going to take a while for that to show up, not just in your systems, but certainly in the outcomes of the people that you may be engaging with. And so just being patient and thoughtful, and again, kind of being as supportive as you can in a way that suggests that you're trying to do community outreach and engage with folks who are actually living it, so that you can get continual perspective, not just one-time things about some of the work that you're trying to do.
Awesome, thank you. And Diane, to close us out.
Yeah, thanks so much. Yes, I'll start here. Like, see us as whole human beings. Alice and Barbie and Tamika and Yolanda and Jamika and I, we all know what it's like to walk into a state or county office seeking services and to be treated as subhuman. Those are facts. We can't overlook that. We can't not talk about that trauma, as we look towards a pathway toward rebuilding trust, if that's indeed the goal of a government built of the people, by the people, and for the people. As human beings with these lived experiences, we also know how it feels to show up in these spaces as advocates and activists, where by the stroke of a pen, others have that power and authority that Dan referenced over our lives and can literally rip food from our tables, from our children's mouths. I've been a SNAP churner for 30 years. 3 decades, I've been on and off of this program. There have been gaps of years when I haven't accessed SNAP, or formerly known as food stamps, we all know. Sometimes it was just a gap of months. And I'm currently not receiving SNAP benefits, though I'm quite sure I'm eligible. I'm in the SNAP gap. But guys, I'm exhausted. I know what it's going to take for me to apply and to prove my eligibility. And I'm literally talking dozens, scores, maybe even of documents to show that my family is in need. That's exhausting. And I know it's not just exhausting for us, it's exhausting for state workers too. So why, I guess my question is like, or the point here is, why would you not engage us when we're looking to solve for efficiencies, when we're looking to create a more efficient and equitable system, we are the experts. We know what it's going to take. So I guess I'll stop there. That's what I hope is the biggest takeaway, is like really look at us and engage with us as the human beings that we are, so that we can move from the transactions of service delivery, data extraction, and story banking into that transformational co-creation of systems where we have played a significant and you know, our rightful role in all of that. So sorry, I know I've taken up too much time, but you know, we're here and we're qualified to help. We can help guide you through these processes.
Thank you so much, Diane, for powerfully closing us out and wrapping this panel discussion up just with the perfect piece of humility. I want to thank Diane, Brianka, and Dan for demonstrating what these conversations look like and sound like when there's no power structures and only equal sharings of the mic. We're thankful for your courageous transparency here today. Thank you again, CHCS, the Robert Wood Johnson Foundation, and each and every one of you in the audience. We may not have been able to see each of you, but we felt you through your willingness to show up here virtually today. We hope we have underscored for you not only the need for systemic change, but the practical action that will lead to true equity within our systems. And with that, I'll pass it on to Alyssa.
Wow, thank you so much, Jamika and Diane and Brianka and Dan, for that just honest and real conversation. We just so appreciate you all raising such important points and doing so very openly. I know we just have a few brief moments remaining here, so I want to take this moment to close out with a few key takeaways that I've been thinking about and reflecting on and jotting down in my notes here next to me in closing us out today. We've just learned so much throughout this project. So I'll try to tackle a few at a high level. So first, there's just such opportunity to not only design programs and policies that improve health, but to design programs and policies that promote healing and dignity and compassion. So as Diane just sort of closed out in her remarks, keeping that humanity at the center for our work. And Brianka, you mentioned the importance of practicing humility as part of that. And Dan, you know, honestly sharing your thoughts on the fact that language matters in response to Diane's comments. And second, just the importance of integrating both individual and community voices into policymaking and decision-making in a supportive way, that participation matters, and not just in a reactionary role or in a feedback only sort of role, but from the onset as partners in design, as true experts, and in shared power to make a difference based on real experiences and expertise, focusing on assets and focusing on real needs. And that context feedback loops are immensely important too. And third, that there are just some really concrete ways in which to integrate individuals with lived expertise into concrete policy levers. Nessa underscored those with examples within her presentation related to Medicaid levers, you know, and there's Medicaid benefit design levers and delivery system levers, including things like 1115 demonstration projects and Medicaid managed care contracts and initiatives. And that there are also just concrete opportunities for partnership across program silos at the state level as well. And much of that, as you've heard today, begins with relationships. So with that, I encourage you all to review the summary report from this project. We ask that you also please provide feedback on this webinar by completing the brief survey that will pop up as you exit out. And just a huge and truly heartfelt thank you to all presenters and panelists this afternoon We have contact information for all of the presenters and panelists here on this slide, and we'll close with also just a huge thanks to each and every one of you on the line for joining us today. So be well, everyone. I hope you have a wonderful rest of the day, and thank you so much. Take care.